a public information officer at the Health Information Center for the COVID-19 response. If anyone needs permission to record, please send a note to our host. And I will wait until I hear before we move forward. Okay, this morning I'd like to welcome Oregon State Public Health Officer and State Epidemiologist, Dr. Dean Seidlinger. He will talk today a little bit about the modeling report that came out this morning. Here are some reminders before we start. This is a call for our media partners. The public are welcome to listen in, but we'd like to reserve this time for the media. So please follow the directions to ask questions. For the public, we do offer public space for our Facebook Live events. So anyone wanting to ask questions, please sign in with your name, your media outlet you are representing. And if you want to ask a question, also send an email to the OHA host. Thank you. And now I'll pass it over to Dr. Seidlinger.
Thank you, Tim. And good morning, everybody. My name is Dean Seidlinger, the State Health Officer and Epidemiologist here in Oregon. I come here today to bring some good news after several weeks of increasing cases. What we're seeing in Oregon is a decrease in cases. Though slower than we'd like, cases are coming down and less people in Oregon are getting sick. Last week, we saw about a 10% decrease in cases week over week after 6 weeks of increasing cases, 5 of those weeks with 20% or more increase. We're also seeing a flattening of those who are in the hospital with COVID-19. Right now, the number is still over 300, but it has not been increasing as dramatically as it was a few weeks ago when we sounded the alarm that more Oregonians were becoming seriously ill, and we needed to increase our actions to prevent the spread of COVID-19 in Oregon. Our modeling data certainly bears this out. It shows that by the end of April, our effective reproductive number, meaning how many people are infected from each person who has COVID-19, was below 1, with a best estimate of about 0.86. What that number means is that hospitalizations would decrease by the beginning of June. We would see, on average, less people in the hospital, 17 people each day being hospitalized at the beginning of June, if we keep up the current actions we have right now. Even if transmission decreased, it would slow that spread of cases, and we would still see 26 people being hospitalized each day. That number is too high, and we hope that Oregonians will continue to take the guidance to get vaccinated and to wear their masks and keep their distance until they are fully protected with the vaccine. That's why the news from the Centers for Disease Control and Prevention was so good yesterday. And looking at how vaccines have performed in the real world, we know that vaccines are very safe and very effective. They offer protection against this disease, and that even those who get the disease are more likely to have mild illness and may not have enough virus to infect others. So that's why the CDC updated their guidance, and Oregon followed suit to say that individuals who are fully vaccinated, meaning 14 days out from their final dose, 1 dose of Johnson & Johnson or their 2nd dose of Pfizer or Moderna, do not need to wear a mask or keep their distance in most public settings outside their home, with some rare exceptions. That means that Oregonians, like people in the rest of the country, have a choice. Protect yourself and your families and those around you by continuing to wear your mask and keep your distance and take some other preventive measures we've all become accustomed to over the last year, or get your vaccine, and that will allow you to remove your mask and do some of the things that we did pre-pandemic. We are working on guidance to provide to businesses and individuals about how to implement this radical change here in Oregon, and this will be the change that will help us as we move forward. Much like spring weather in Oregon, where right now it's sunny and warm, but we know we're not guaranteed sunny days all the way into summer. That's how COVID is. Right now, we're seeing decrease in cases and decrease in hospitalizations. But that decrease in cases depends on all of us taking action. Get your COVID-19 vaccine if you haven't already. If you've gotten your vaccine, talk to your family and friends, help them make a plan to get their vaccines. This protection from the vaccine will allow everyone to see decreased COVID cases as we move into the summer and be like the summer weather, almost guaranteed of sun and warm temperatures throughout the Oregon summer. We'll be able to enjoy our summer fairs and festivals and other activities together like we weren't last summer. And we can all do this together by getting vaccinated. And until then, wearing our masks and keeping our distance. With that, I'm happy to take questions.
Thank you, Dr. Seidlinger. I just want to remind the media attending, please to list your name and your media outlet. Okay, we have a question from Aaron Ross. Aaron, please go ahead.
Hi, Dean. So it sounds like though with this current modeling, with our current information, circulation is still higher than we would like it to be. You said it's not going down as fast as we would like. Given that really what protects people who are vaccinated, since we have had 8 deaths in people who have been vaccinated, is also having low circulation. What does that mean for mask use indoors, especially in counties where circulation still seems to be very high? People are still going to be at risk. What do you recommend people do?
Thank you, Aaron. I think what we have is affirmation from the Centers for Disease Control Prevention of some recent studies we have of how vaccines perform in the real world. The vaccine offers amazing protection to the individual who gets it. That, yes, tragically, we've seen some people get sick, a much smaller percentage of those individuals be hospitalized, and a very small percentage of individuals who have died with COVID following receipt of their vaccine. But we have to remember that even that 611 breakthrough cases we've seen here represents a very small fraction of the cases we've seen since we began vaccination. That's about the number of individuals who get sick in one day from our recent case counts. And we've had vaccination, since the middle of December. So for people who are inside, who are vaccinated without their mask, they have great protection from the vaccine, and they will not spread the disease to others in that setting. For individuals who are inside and unvaccinated, wearing their mask, keeping their distance will help to provide them protection. We have multiple tools, but we know for those individuals who are unvaccinated, they're not going to spread the disease to others in indoor settings or outdoor settings without their mask on.
And what do you expect will happen over the course of the next few weeks to months in communities that have had both low mask compliance already and also have low vaccine adoption rates?
I think I want to encourage individuals to take steps to protect themselves and those around them. We have tools available, and those tools are what you stated. We have the tools that we've been using since last summer, keeping our distance, wearing our mask, and we know these have cut down on transmission, have kept Oregon as one of the lowest states in terms of case rates and fatalities from COVID across the nation. And that's people coming together and following the rules and taking those steps to protect themselves and their loved ones. Now we have some other amazing tools. We have 3 very safe and effective vaccines that people can choose to use. I think individuals have a choice. Which kind of protection do they want to use? Like I said, this is a team sport. This is something that protects those individuals and those around them from COVID. And by all working together, that's how we're going to drive these cases down even further so we can get back towards living a normal life, fully reopening the Oregon economy, and thinking about those future plans, the celebrations that we postponed, the mourning and the grievances that we postponed because of COVID, the trips we want to take, the people we want to see. And it's only by using a form of protection that works for you, masks and physical distancing or vaccination. And I hope more people choose vaccination because it's safe, it's effective, and it's available across the state right now.
Thank you.
Thank you, Aaron. We'll now go to Ben Botkin for the Lund Report.
Yes, I was hoping you could maybe clarify as much as you can just the relationship between the CDC guidance and the county risk level framework. For example, if say a restaurant has nothing but vaccinated customers, is it still required to follow the capacity limits outlined in the risk level framework? Maybe you could just speak to that a little bit if you can. Thanks.
Thank you, Ben. For now, the county risk level framework that was implemented in the fall with our surge in cases and hospital capacity constraints remains in place. This means that businesses have different constraints on capacity, and people have different levels of activity available to them depending on the level of COVID spread in their community, from very low and our lowest risk to extreme. That framework remains in place. As Governor Brown stated earlier this week, we have paths forward to get out of the county risk level framework. If a county has 65% of their population 16 and over vaccinated, and a plan to reduce the gap between the vaccination rates in communities of color and those other communities, that they can move to the lowest risk immediately, no matter what their case rates are. That when the state reaches 70% of 16 and over, that the county risk level framework will go away and we'll go to some basic protection frameworks that may include masks in certain locations and physical distancing, particularly for those who are unvaccinated. So right now that framework remains in place. What the CDC announcement yesterday and the OHA guidance that we will be releasing soon does is allows that restaurant that you mentioned, that if they choose to check vaccination status of those who come in, that those individuals do not need to wear their mask while they're in the restaurant if they're vaccinated, that they do not need to maintain physical distance from other when they're vaccinated. That doesn't mean that the capacity limits increase, but it means they can use their space differently and possibly serve more customers that they weren't able to serve before. What we're not saying is that businesses can choose to only serve vaccinated people and exclude service for others. Businesses should have a plan to either keep the current guidance in place where they require physical distancing and masking for everyone, or implement a plan where they're checking the vaccination status of those who come in, and that those individuals could be allowed to be in that business without wearing a mask and with less physical distancing.
Thank you, Ben. We'll now go on to Lincoln Graves from K2.
Dr. Seidlinger, you just mentioned businesses checking vaccination status. We want to get some more clarity on how this would work. Will this be up to businesses? Is this the honor system? Are businesses going to have to be the vaccine police in all of this?
Thank you, Lincoln. I think right now we're still working on some of the details, but as Governor Brown stated yesterday, businesses can choose to use the current guidance that's in place, operating with mask requirements for customers and employees in their establishment and keeping distance between different parties to prevent the spread of COVID-19. For businesses that choose to allow customers or employees in their setting to remove their mask and not have physical distancing, we are setting up some guidance for things that they can do to check on vaccination status with individuals who come into the business. This could include seeing their vaccination card, a picture of their vaccination card, and checking that they truly have been fully vaccinated. It's been 2 weeks since their last vaccine. This will allow them to serve those customers in a different way.
Let me ask one quick follow-up then. What are the public health implications to somebody lying to get into a business? Obviously, people who are vaccinated, they would assume they're protected. The person who may be lying about their status, are they the ones that are putting themselves in danger, perhaps?
I think a person who's unvaccinated, who chooses to lie about their vaccine status and not wear a mask, is putting themselves and others at risk. By not wearing a mask and not having a vaccine, they don't have the protection if someone else in that environment has COVID and could spread it to them. They also, if they have COVID and maybe don't have symptoms, they could unwittingly spread that disease to someone else. The individual or the person they spread it to, or the people those people go home to, families and loved ones, any of them could develop serious complications. So we hope that people will take the steps they need to protect themselves and their loved ones and those around them, because it's only by either getting a vaccine, which offers great protection and is very safe, or continuing to wear your mask, continuing to keep your distance to prevent the spread to others, that we're going to get this disease under control. I hope that no one out there is dishonest people have choices now about how they want to protect themselves and their communities, and we hope that they'll do that.
And real quickly, do you know when new guidance will be released?
We are working on guidance very quickly. As you can probably imagine, this is a radical shift in the CDC framework and is a change in how we have our guidance. We have guidance specifically on face coverings, but then guidance on keeping 6 feet of distance across multiple sectors. We want to make sure that all of that is updated, that we're trying to anticipate questions, concerns that we have from businesses and the general public, that we can provide them that guidance on how to proceed. So we hope to do that relatively quickly. The exact timeline, I don't know.
Thank you.
Thank you, Lincoln. And we'll go on to Pat Doris from KGW TV.
Thank you. Good morning, Dr. Seidlinger. So a couple of quick questions. One, I didn't see anywhere in the CDC guidance that businesses are required to check for vaccination status. Why has the state made that decision that that would be part of this here?
Thank you, Pat. I think the CDC guidance lays out a general framework that individuals who are vaccinated are protected from COVID-19 and do not need to wear a mask or keep their distance when they're outside of their home, out in public, out in businesses. They did not go into details about how that works. They spelled out specific sectors where that guidance would not take effect. These include healthcare settings, homeless shelters, correctional facilities, public transit, airport and transit hubs. And they deferred to the CDC guidance on schools for how to incorporate masks into those settings. Other than that, they didn't go into details, and it's left up to states, local governments, and businesses on how to implement that.
I understand that, which is why my question is, why does the state requiring it then?
Because in order to meet the CDC guidance that someone who is vaccinated does not need to wear a mask or keep their distance, we need to know who is vaccinated. So we need someone to be able to disclose that their vaccination status and show that so that they can remove their mask in the setting and not keep their distance. This is part of the operational rollout that Oregon, other states, localities, and businesses will have to do if they choose to implement the new CDC guidance. Different states will do it in different ways.
Thank you. Just a final follow-up. I think there's a lot of businesses and a lot of people, customers out there wondering why it takes so long for the OHA to put out guidance. You have grocery stores and restaurants and churches, a lot of folks waiting for this, and it does sort of sound like you have it in your head based on the way that you've been talking to us. So why does it take so long?
As you said, we have a lot of people waiting for this guidance, and you mentioned several different sectors. We need to look at our guidance on face coverings that covers who should wear a face covering and in what settings. We have to look at all of the sector guidance, which includes information about physical distancing and other things, and make sure that the new guidance we have out aligns with that. We need to work with our regulatory partners, such as OHA, to make sure that we're all in alignment. This announcement from the Centers for Disease Control came out just yesterday, and I anticipate we'll have guidance very soon, and we will be able to turn this around. So we know that people are waiting for this, and we know we're going to get it out as quickly as we can. I've laid out the framework of what I anticipate it's going to look like, but we want to try and anticipate questions, provide people the resources they need to implement this successfully so that people can continue to protect themselves, their family and loved ones, and their communities by either having a vaccine and being completely vaccinated or continuing to wear their face covering and keeping their distance, because it's those activities together that are going to continue to slow the spread of COVID-19 in Oregon and allow us to get back to a more normal summer.
Thank you, Pat. We'll go on now to Brad Schmidt from the Oregonian. Brad?
Hey, Dr. Seidlinger, thanks for taking my call. I have two questions. In practical terms, do you envision businesses having trouble actually turning this into practice? I mean, what are we going to have door checkers reviewing vaccination cards? And will there be state money to help cover these expenses? Do you expect there's going to be conflicts like we saw earlier in the pandemic when masks were first required? And then the second question is, given that Oregon's tied for 9th to 12th in the country right now for per capita case rates over the past 2 weeks, and we know that masks have been a contentious issue, are you concerned that unvaccinated people will opt not to wear masks and ultimately spread coronavirus to others who also are unvaccinated and are opting not to wear masks in violation of the spirit of the rules? Thanks.
Thank you, Brad. I think, let me take the second part first. Yes, Oregon is in the unenviable position of having one of the highest case rates in the past week amongst states. Our cases aren't nearly as high as some of our states in the Midwest and East Coast were during the spring surge, but they're much higher than we'd like. This new rule does nothing to weaken the protection we have to decrease the spread of COVID-19. As I said, the studies show that the COVID-19 vaccine works very well in the real world. It offers protection to the individual themselves, and it also makes it very unlikely that even if they have an infection or an asymptomatic infection, that they'll be able to spread it to others. So that's why an individual who's fully vaccinated does not need to wear a mask or keep their distance, but an individual who's not fully vaccinated will still need to continue to take those precautions. So it's only by everyone taking some precautions to protect themselves and those around them that we're going to continue to lower our cases, as we've seen over the last week. As for state money specifically to help businesses with this mandate, Governor Brown did announce some additional funding that will go towards counties when she announced the changes that counties can see as they move towards a county goal of 65% of 16 and older, and as we move towards a state goal of 70% of 16 and older to try and incentivize vaccine and to use that in their communities to try and get more people vaccinated. You asked about our business is going to have a greeter who checks vaccination status. Under current guidance, our businesses, for the most part, are required to have someone who's doing some social distance monitoring, who's helping to check that people are wearing their vaccine and to see that other people are following the rules. So we would anticipate that it would be a shift of how people are doing their job. We know that our frontline workers have been the brunt of many customers and others who have not wanted to wear a mask during this past year, and others who have not wanted to follow the rules that protect themselves and the community around them. And that's been very difficult, and many of those complaints have gone to Oregon OHA. We know that this puts them in a different position of needing, if they choose to implement a system where those who are not vaccinated can come into the business without a mask, without physical distancing, it'll require them to ask about vaccination status and check on that before they come in. And that'll put some in a difficult position. And that's why I'm asking and hoping that Oregonians will continue to do what's right, continue to do what protects themselves and their loved ones and communities, by choosing to either protect themselves by wearing a mask or keeping their distance, or to get vaccinated. And if they choose to get vaccinated and a business allows them to be in there without a mask or physical distancing, that they work with the person who meets them at the store and tell them about their vaccination status and show the proof of their vaccination.
Thank you, Brad. We'll now go to Brenna Kelly, KPTV.
Hi, thanks for taking my question, Dr. Seidlinger. I know business guidance is forthcoming, but since it isn't here yet, some businesses will likely be adopting these new CDC guidelines tonight and this weekend. Can it be as easy for them as asking the question and having the person say, yes, I am vaccinated, versus seeing that physical vaccination card? And if not, and if you're saying this will require physical proof, will this be enforced before guidelines come out by OSHA or local law enforcement? What will that look like? And additionally, are there HIPAA implications by asking, for instance, employees if they've been vaccinated?
Let me take the second question first. For an individual who voluntarily declares, either as a customer coming into a business or as an employee, that they're vaccinated and don't want to wear their mask and then show the vaccination status, that is not a violation of HIPAA or privacy, as they're voluntarily disclosing that information. We hope that businesses will will take steps now to protect their employees and their customers if they choose to implement this new system and allow people to come in without masks. Well, that's why we're trying to write guidance, resource documents, and answers to frequently asked questions that we anticipate coming up, so that businesses know what they can and should be doing to implement this new CDC guidance. We hope to have that out soon, and that's what will help form the basis for Oregon Health Authority in implementing these guidance, and our regulatory partners like OSHA from enforcing these guidance. So we're working on getting those out as quickly as we can. And until then, if businesses have questions, they can continue, as the governor said, to use the current rules to require masks and physical distancing. And that will be their choice going forward, that they can choose to use those guidance that already exists.
Thank you. We have a follow-up question from Erin Ross, OPB.
We've seen throughout the pandemic a large number of businesses that have been fairly anti-mask from the start and have put up signs and things to that effect. Now that do you expect those businesses to enforce the vaccine regulations for unmasking? And if they don't, how will they be held accountable?
Thank you, Erin. I think when we issue guidance, we would expect all individuals and businesses to follow that guidance. Right now, that guidance will give, the updated guidance will give people a choice, will give businesses a choice. They can continue with the current structure that's in place, requiring masks and physical distancing in most locations. If they choose to implement the OHA guidance, which is in alignment with the new CDC guidance, that individuals who are fully vaccinated do not need to wear a mask, do not need to keep their distance. They will need to have a system in place to check for that status so that they can allow that to happen. Businesses have a choice about which system to implement, and individuals have a choice. Get vaccinated to protect yourself, your family, and your loved ones. Continue to wear your mask and keep your distance. We all have tools in our toolbox to protect ourselves, and people will choose the one that's right for them. Right now, I would encourage everyone who's eligible, that's Oregonians 12 and up, to get vaccinated. Vaccines are safe, effective, they're available throughout the state. Make an appointment, walk in many locations, and get vaccinated.
Thank you, Aaron. We'll now go to Lincoln Graves. Lincoln?
Yeah, Dr. Seidlinger, I just want to follow up on a question another reporter just asked. And I know we're waiting for guidance, so I know there's still some information to come, but I just want to clarify, do we know enough right now as to whether a customer can simply say, yes, I'm vaccinated, or will they have to show proof?
Thank you, Lincoln. While we're still working through details of the guidance, we would anticipate that an establishment, a business will have to have a system in place for asking about vaccine status and verifying that. Right now, I would anticipate that would be seeing a card with the individual's name, the vaccines they've gotten and the date and where they've gotten them. That could be a picture of that vaccine card or record from their provider on their phone, but a way of just seeing that does not need to be recorded, because we need to know that they're vaccinated so that business knows that their employees and that their other customers are protected. Right now with the system we had in place before the CDC guidance, that everyone in that establishment should be wearing a mask and keeping their distance. That was easy to tell from across the room. For this one, it will require people who choose not to wear their mask in a business and not to keep their distance, that they will need to have to disclose their vaccine status and show that to the business. We're working on the details of what that looks like right now, but that's what I anticipate it would be.
Thank you.
And seeing no further questions, thank you, Dr. Seidlinger. Thank you to the media for participating, and have a great day.
Thank you, everyone.